Sometimes, as we go through life, we master our experiences. Sometimes we don't.
Adjustment disorder, often called situational depression, is a relatively common short-term condition that occurs when a person has an abnormal and excessive reaction to a particular stressor, positive or negative, such as a major life event, loss of a loved one, or any unexpected change. Most people are able to adjust to stressful events within a few months. With adjustment disorder, however, sufferers are unable to cope with the stress and may experience a variety of symptoms ranging from mild to severe. Symptoms of adjustment disorder vary according to the intensity of the triggering situation, as well as the personal significance it has for a particular individual, but may include sadness, anxiety, hopelessness, and loss of interest in everyday activities. Adjustment disorder may also cause physical symptoms, ranging from headaches and stomach aches to agitation, palpitations, lethargy, and twitching. A number of behavioral symptoms may be present as well, such as changes in eating and sleeping habits, difficulty concentrating, isolation, missing work, and engaging in destructive or reckless behavior, such as using alcohol or drugs. These symptoms typically begin within 3 months of the stressful event and seldom last longer than 6 months beyond the original incident that triggered the stress. The circumstances triggering adjustment disorder include virtually any situation an individual perceives as stressful, from positive events like getting married or having a baby, to financial difficulties, divorce, job loss, serious illness, unexpected tragedy, or a disastrous event, such as an earthquake, fire, or flood. While adjustment disorder can affect anyone of any age, and is typically experienced equally by both men and women, it occurs most commonly during times of major life transitions, such as during adolescence, middle age, and in the elderly. An individual's susceptibility to adjustment disorder may also involve changes in brain chemicals called neurotransmitters, especially serotonin, which helps regulate mood. Personality, temperament, well-being, life experiences, and family history are each thought to play a role as well. In many cases, the symptoms of adjustment disorder are resolved on their own through the individual's gradual adaptation to the stressful situation or event. Treatment for adjustment disorder typically includes supportive psychotherapy that assists sufferers in putting the stressor in perspective and helps optimize coping skills. Anti-anxiety medications may be suggested for short-term relief of anxiety or insomnia. Some sufferers find it helpful to discuss their feelings in a support group setting with others who are coping with similar situations. But if symptoms become so overwhelming that it becomes difficult to get through the day, it's wise to see your doctor.
Also known as manic depression, bipolar disorder is characterized by extreme moods that swing between poles of mania and depression. These episodes may range from mild to severe, depending on the disorder type: bipolar 1, bipolar 2, rapid cycling, mixed bipolar, or cyclothymia. All bipolar types experience manic or hypomanic and depressive episodes to varying degrees. Mania is typified by sudden euphoria or rage, hyperactivity, inflated self-esteem, racing thoughts, decreased need for sleep, and preoccupation with irrelevant matters. Mania may also include reckless behavior like extravagant shopping sprees, risky sexual activity, or foolish investments. Hypomania is a mild form of mania, characterized by hyperactivity and euphoria. The depression side of bipolar disorder mirrors the symptoms of major depression: persistent sadness and fatigue, loss of interest in activities, changes in sleeping and eating patterns, difficulty concentrating, feelings of hopelessness and worthlessness, and thoughts of death or suicide. Of the various bipolar types, the most severe is bipolar I disorder. Those who have this type may experience manic episodes that begin suddenly and last for an average of 4 months. Depressive episodes may last even longer, persisting approximately 6 months, but rarely for longer than a year. Bipolar I sufferers may require hospitalization either because a manic episode is out of control or depression is so severe that the risk of suicide is high. The presence of mixed episodes, which combine manic and depressive symptoms, may further heighten the suicide risk. Bipolar II disorder is considered a milder form of bipolar disorder and is the most common. Bipolar II disorder sufferers typically experience less intense hypomanic episodes of euphoric or irritable mood, followed by depressive episodes, which are often experienced with greater intensity. Hypomania may appear as simply an outgoing personality, in some making diagnosis difficult, while others may experience it as a negative state that causes severe agitation and difficulty concentrating. Without treatment, hypomanic episodes may escalate to full mania. Rapid cycling bipolar disorder is characterized by alternating episodes of mania and depression within a short period of time. The periods of depression tend to be predominant, interspersed with briefer periods of abnormally elevated manic or hypomanic mood instability. Studies suggest that 10 to 20% of people with bipolar disorder develop the rapid cycling pattern typically later into the illness. While virtually anyone can develop rapid cycling bipolar disorder, it occurs more frequently in women than men. With mixed bipolar disorder, the highs and lows of the illness typically occur simultaneously in rapid succession as either dysphoric mania, which is a manic episode with unpleasant or depressed mood, or agitated depression, which is a depressive episode with mania symptoms such as anger and irritability. Hospitalization may occur for mixed episodes as they may be accompanied by psychotic symptoms including hallucinations or delusional behavior. It's estimated that 20 to 70% of bipolar disorder sufferers experience mixed episodes, particularly when the illness begins during adolescence. Cyclothymia is a milder form of bipolar disorder with highs and lows characterized by hypomania and mild to moderate depression. Those with cyclothymia typically stay connected to reality. If you think you may have a type of bipolar disorder, consult a mental health professional.
What differentiates generalized anxiety disorder from normal stress is an excessive, exaggerated worry about everyday life events. People with generalized anxiety disorder are anxious in a way that's out of proportion with what's happening. When someone has GAD, a constant state of worry and dread comes to dominate that person's thinking, so much so that it interferes with regular daily functions like work, school, and relationships. Symptoms of generalized anxiety disorder can be similar to stress, but more intense. Some key symptoms of GAD include excessive, ongoing worry, restlessness, irritability, muscle tension, and headaches. Most sufferers also experience difficulty concentrating and have trouble sleeping. About 10 million adult Americans suffer from GAD during the course of a year. It most often begins in childhood or adolescence, but can begin in adulthood and is more common in women than in men. Most people who have had GAD are likely to experience it again. The exact cause of generalized anxiety disorder is not fully known, but a number of factors appear to contribute to its development. Research suggests that family history plays a part in whether a person will develop GAD. This means that the tendency to develop GAD may be passed on in families. GAD has also been associated with abnormal levels of certain neurotransmitters in the brain. Neurotransmitters are special chemical messengers that help move information from nerve cell to nerve cell. If the neurotransmitters are out of balance, messages cannot get through the brain properly, which can lead to anxiety. As well, trauma and stressful events, like the death of a loved one, divorce, or changing jobs, may lead to GAD, and symptoms of GAD often become worse during periods of stress. A diagnosis of GAD is based on the intensity and duration of anxiety symptoms and on whether those symptoms interfere with normal daily functioning. GAD is diagnosed if symptoms are present for more days than not during a period of at least 6 months. If you think you might be suffering from GAD, contact a health professional.
Want to learn more? Check out other videos and sources on this site for more information.
Antisocial personality disorder is a psychiatric condition in which a person manipulates, exploits, or violates the rights of others. Antisocial personality disorder is a mental illness affecting up to 1% of women and 3 to 5% of men in the United States, according to Mayo Clinic data. This behavior is often criminal. One of the biggest signs of antisocial personality disorder is a pervasive disregard for right and wrong and for society's norms. As such, people with this disorder often engage in criminal activity, resulting in frequent run-ins with the law. A person with antisocial personality disorder often lies, steals, and causes fights with others. Another facet of antisocial personality disorder is a blatant disregard for the rights and feelings of other people, which often manifests not only as lies, but as deceit, often coupled with intimidation of others. Violent and aggressive behavior is typical. Often a person with this disorder does not show any guilt for their actions. It's not surprising that it's almost impossible for someone with antisocial personality disorder to engage in real intimacy with another person. Despite this, people with antisocial personality disorder are very good at displaying superficial charm and at flattering and manipulating others. Symptoms tend to peak during the late teenage years and early 20s. They may improve on their own by a person's 40s. Complications can include imprisonment and drug abuse. And antisocial personality disorder can also often come hand in hand with other impulse control problems like chronic gambling. Additionally, people with this illness often have additional mood disorders related to depression and anxiety. Antisocial personality disorder is one of the most difficult personality disorders to treat. People with this condition rarely seek treatment on their own. They may only start therapy when required to by a court. The effectiveness of treatment for antisocial personality disorder is not known. And in order to make accurate diagnoses, psychiatrists use a set of specific identifying guidelines laid out by the American Psychiatric Association. Aside from possessing a blatant disregard for the rights and feelings of others, a person cannot be diagnosed with antisocial personality disorder unless he or she is at least 18 years of age and has demonstrated symptoms of conduct disorder, like stealing or violence, before age 15. Even once diagnosed, it can be difficult to treat antisocial personality disorder. This is largely because, by definition, people with the illness do not care that they are causing pain and problems. If a person is willing to receive treatment, it usually comes in the form of psychotherapy or talk therapy. Occasionally, medications may be prescribed to treat certain symptoms of the condition, such as depression or mood instability. In some cases, hospitalization in a mental facility or incarceration in a prison are necessary treatment steps. If you think you or a loved one may be affected by antisocial personality disorder, please make an appointment to see a mental health professional.
Let's talk now about cognitive disorders. These are the disorders which are either characterized by the syndromes of delirium, dementia, and the amnestic disorders. Now, what typically causes these disorders will either be medical problems or substance abuse problems, or probably a combination of the two. What typically occurs in patients who have these disorders is that you tend to see more of them in the patients that are either very young or the patients that are very old, the patients that are very sick, the patients that have medical problems, or the patients that have substance abuse problems, or have been exposed to a variety of substances for a period of time.